Maya Angelou once said, "They may forget your name, but they will never forget how you made them feel." During their hospital stay, patients will meet a dozen or more people. They may not remember every person or experience, but they will remember compassion, concern, and empathy. On average, patients only remember 20% of what they hear while they're in the hospital, so we must make what we tell them count. Today, we will discuss how to teach patients thoroughly, efficiently, and with compassion. Our presenters today include myself. My name is Melanie Durham, and I'm a nurse practitioner and manager at a heart hospital in Dallas, Texas. I have over 18 years of patient care experience in various healthcare roles. Our second presenter will be Ahmed Al-Sayed El-Khoury. He is a pharmacy director at Riverside Shore Memorial Hospital in Nacogdoches, Virginia. He has 17 years experience as a clinical pharmacist and manager in hospital, retail, and pharmaceutical industries. Our third presenter today is Carol Castro. She is an anesthesiologist and former family and community medicine physician for the city of Recife in Brazil. The fourth presenter will be Garland DeShazer, who is a senior financial analyst for Hospital Corporation of America, TriStar Division, and has been in that role for 4 years. Today we will discuss research behind the issues with and barriers to nurses educating patients, the needs of nurses with regards to providing accurate and thorough education, possible training activities, and practical recommendations and evaluation tools for nurse audiences. Nursing teaching patients is a significant issue in today's healthcare field. Multiple research studies have been done on this topic, ranging from importance to patients, to nurses' attitudes, to appropriate techniques for various patient healthcare literacy levels. One research study was performed by Kruijsver and colleagues in 2000. They reviewed 127 articles from 1980 to 1997 to determine how nursing communication behaviors affected coping responses to cancer diagnosis and treatment. A second research study done by Carpenter and Bell in 2002 surveyed 44 nurses regarding their knowledge level about teaching processes and the application of these processes to case study scenarios. A teaching intervention was then offered with a post-test given thereafter. A third research study was done by Beagley in 2011 and discussed barriers facing nurses when providing healthcare information and education. These barriers include literacy, culture, language, and physiological factors. Now, we have all been patients in the past. Most of us have also been hospital patients. So please imagine with me sitting in a hospital room waiting to be discharged, eager to go home, yet fearful of how you will care for yourself when you leave the hospital. You are confused about what has happened during the hospital stay, how you will know what medications to take when you go home and when those medications should be taken, what outcomes you might expect, and when you should follow up with your physician. Now, imagine a nurse coming into your room to provide the discharge teaching. The nurse is rushed. She does not know how to pronounce most of the medications you take and is unsure in her answers to your questions regarding follow-up visits. How confident are you in leaving that hospital room? How would things appear if the nurse provided accurate, well-informed answers to you? What if she took the time to answer each of your questions and to make sure that you understand all medication directions? She also asked you to repeat back key phrases or points. This is the importance of nurses teaching patients. Now that we've covered the problem, Ahmed is going to discuss some training opportunities with you.